Hello, I'm Emily Arnold. I'm an anthropologist on the faculty of the Department of Medicine at UC San Francisco, and I lead the Northern California HIV/AIDS Policy Research Center.
Hi, I'm Stefano Bertozzi, and I'm a physician health economist. I'm on the faculty at UC Berkeley in the School of Public Health, and I collaborate with our team closely with Emily.
In 2025, we focused on understanding the real-world challenges that shape HIV prevention and care across our state. Our work this year helps shine a light on issues affecting both the people who need services and the people who provide them.
We partnered with the Southern California Center on PrEP access updates. That's a brief that explains the barriers people still face when they're trying to get PrEP. Things like insurance rules, pharmacy challenges, delays in authorization that can all make it harder for people to stay on prevention medication. Our goal was to give policymakers clear, practical recommendations to help fix these problems. In 2022, we worked with the Southern California Center on the California Pharmacist Study. That study examined the implementation of PrEP services that are delivered by pharmacists. And we now have a follow-up study that is looking at pharmacies all across California that's funded by Gilead. The preliminary results show that only just over 2% of California pharmacies are delivering PrEP that's prescribed by pharmacists. And over the coming months, we'll be digging into understanding why uptake has been so low and what policy changes could motivate pharmacists to participate.
Our team also explored the ways that overlapping epidemics like HIV, hepatitis C, homelessness, and the overdose crisis overlap in California, creating something called a syndemic. We wanted to document what it takes to put syndemic approaches into practice in terms of programs on the ground, as well as the policy and system level structures that would be needed to accomplish this. Providers we interviewed told us that addressing underlying issues like trauma, mental health, substance use, and housing issues all at once is essential, but difficult because systems don't always work together. This research highlights where improvements are needed to support whole person care here in California. Another major focus this year was the HIV workforce. In our Exploring Burnout and Resilience report, we heard from providers who were under pressure from high caseloads, administrative tasks, and staffing shortages. Our team also identified what helps workers stay resilient, including supportive supervision and opportunities for growth.
In the year ahead, we're going to be working with the California Department of Public Health and with the state prison system, and we're going to be evaluating the continuity of care for HIV care among people living with HIV who are released from California prisons. That research is going to reveal both the best practices for the people who are successfully continued and opportunities for improvement in ensuring quality HIV services and support during the community reentry after incarceration. We're also going to be fielding a project to better understand the best ways for us to communicate our findings to broad audiences, including people with lived experiences and youth. We want to do that to make policy research more accessible and more useful on the ground.
Each of these projects helps California leaders better understand what's working, what isn't, and what changes can improve the HIV response across the state. For more information about our work and the full set of reports, please visit chprc.org.